treatment exists for non-epileptic seizures. It has started to really take off to look at many different options, but the most common treatment with the most data is for cognitive behavioral therapy, also called CBT. And the largest trial was done fairly recently by Laura Goldstein and a group in the UK. It's called the CODES trial. It's a randomized controlled trial looking at a large group of patients with this disorder. They call it dissociative seizures in the UK. You can see some of the problems we have here by all the different names we have for this stigmatized disorder that we have to help improve. But CBT was performed. There's about 150 ultimately in each group. That is the ones that received CBT in standard medical care and those that just got standard medical care. And this study was done in the UK, as mentioned, where a large group of doctors are very familiar with this disorder. And what they found was their primary outcome, which was seizure frequency, was not significantly different, unfortunately, at their 12-month mark. However, the secondary outcomes, and there were many of them, bothersomeness of the seizure, quality of life, overall how they were feeling, was significantly improved. And I think there needs to be follow-up for this study because I would say in the U.S., there are probably many more neurologists that are not quite as knowledgeable and comfortable with this disorder. So it may be that they got better results even than people practicing standard medical care. Other treatments, the ones that we focus on at Brigham Women's Hospital, led by Dr. Gaston Bezlet, who's the chief of neuropsychiatry there, are a mindfulness-based form of a CBT type treatment. And this is a 12-week manualized program where patients are seen weekly. And so there are other treatments. There's not as much, randomized controlled trials out there. And our trial was not an RCT either. So there's a lot more work to be done in treatment.